Well, first of all, thank you very much indeed for inviting us to be here today. I think.
Excuse me. I'm sorry.
I've forgotten.
I've forgotten. Evangelina Reyes. Are you? Is she here? Yes, please. I'm sorry. I meant to invite you to the stage. Please, please. I beg your forgiveness. I'm terribly sorry.
No, that's fine, no worries. So yes, I just wanted to, I think I have also one slide that will basically be during my 4 minutes. I think today's conference is really timely, of course, with the European Commission and the OECD country profile report, which is really giving us good profile of countries that fare well and fare a little bit less well. But also in the coming months with the European Commission Council recommendations on vaccine preventable cancers. And of course, I mean, I'm here to represent the vaccine manufacturers, and for us, it's quite, we have this view that there is one mission, a public health mission, is that to offer a Europe free of vaccine preventable cancers. And you know what? I think we can do it. I think that we have really efficient vaccines against HPV, against also hepatitis B. And I think there is really a unique chance right now in this moment to offer a Europe free of vaccine preventable cancers and to offer to the next young, but also adult population and generation a chance to be free from cancers caused by viruses. But to achieve that mission, I think we need, of course, plenty of measures, but I think they can be grouped in two buckets. The first one that we need is that we need to have national vaccination programs and the right background to offer convenient and free access to vaccination with adequate and sustainable financing. I mean, again, I think we will hear from the OECD later on, but I think that when you have those right programs in place, you really see an improvement in the coverage rate, but also in improvement in the outcomes for cancer. The second bucket is, I think, on data. It has been already said in the previous panel. If you know what is happening, you can improve. And right now, I mean, we do have indeed some data systems in Europe, but it's really also a little bit patchy around countries. And we need those data to really timely monitor what is happening, to really have an idea of the performance of the programs, so we can adapt and fine-tune a bit. But that's where also the inequalities are and lie in those two buckets. For the programs, some countries are really performing well. I mean, indeed, Portugal, Italy as well, and also some of the Nordics, and some a little bit less. Greece is in the middle, I think I have to say. I mean, indeed, regarding HPV, for girls, it's now 55% of coverage rate, which is still a bit far from the target of 90% to eliminate HPV. But it's going into the right direction. I think last year we heard that there is a new cohort for boys to be included into HPV. So we see there is an action plan as well from ministry as well. So I think it's really good. Regarding data, that's also where we see inequalities. Definitely, I mean, we have seen with COVID-19, if we want to do it, we can track it even weekly, even daily, what is happening. So why don't we have that for routine programs? So let's put that in place. I think that in Greece, there is also a lot of good developments in the Greece 2.0 plan. And I think right now we need to link those registries. I think you have an IDICA in Greece that could be linked to the national cancer plans as well. And all of that, if we group that and if we put that together, you will have more solid and also accessible in terms of free but also convenient access to adolescents for them to get vaccinated. Because that's where we have a really strong focus now, is to provide free and accessible access to vaccines against cancer in Europe. And I think Greece is on the right path, and I'm really happy to be here today to discuss this with you and with our Greek friends in the room. Thank you.